listening to What's Your Wrinkle with Dr. Arthur Perry. What's your wrinkle?
And we're back. I'm Dr. Arthur Perry. This is What's Your Wrinkle right here on WABC. And this is the show about you and the show about your health also. And if you listened to me earlier in the show, I was talking to you about the flu virus, which is at very high levels in the entire United States, except maybe for some reason Hawaii has been spared. But the CDC, that's the Center for Disease Control, says that this outbreak is one of the worst since they started keeping track. And certainly the worst in New Jersey, and I think the worst since the swine flu epidemic of 2009. Remember those days? People were walking around wearing surgical masks around Manhattan. Remember that? It might be coming back. My guest tonight is Dr. Christopher Freer. I hope I'm pronouncing your name right. And he is the chairman of the emergency department at St. Barnabas Medical Center, which is part of the Robert Wood Johnson Barnabas Health family now. And welcome to St. Barnabas and Dr. Freer. Dr. Freer trained at Johns Hopkins. He's an expert in emergency care and in particular influenza. So he's going to tell you how to protect yourself tonight. Thanks for taking time, Dr. Freer. Thank you.
Thank you. Thank you. Thanks for having me tonight.
All right, so let's start out. Who's most at risk for the flu?
The most at-risk patient population is the extremes of age, the very young and the elderly. So, children that are under 2 and patients that are elderly really have to be careful when they come down with the symptoms to seek medical attention.
So everybody's talking about this year is a terrible year for influenza. Why is that?
The strand that this year, viruses are very smart and they tend to mutate, and we try to get the vaccines right. Everyone should still get the vaccine, but this year the effectiveness has been on the lower side in regards to preventing the flu. So it's been, as you said, has been a year to remember. About the last time I remember at this level was back in 2009 with H1N1.
Yeah, and I remember that well, and it's actually frightening. I think some of those years there were also flu vaccine shortages. Certainly, at least we don't have that going around this year. Although I have heard of some Tamiflu shortages, but we'll talk about that in just a second. But first, tell the listeners, what are the signs and symptoms of the flu? What do people need to look out for?
Well, fever, that's one that comes right away, and you have body aches, headache, cough, sore throat. This year there seems to be we're seeing a little bit more of GI symptoms, feeling nauseated and sometimes even vomiting are the symptoms typically with the flu.
Yeah, and one of the things that a lot of people get colds and they say, oh, I'm getting the flu. And I remember, tell me if you think this is accurate, but I remember way back from my days in medical school, we were taught that influenza has such a sudden onset. People could say, well, at 3:43 I got influenza, as opposed to a cold which kind of sneaks up on you through the day. Is that accurate still?
Yeah, influenza is definitely more aggressive, and the symptoms more hit you a little harder than your typical cold. So, your typical cold you usually can get through the day and, usually even get to work, whereas the flu you're really, knocked down when you get it, and it is pretty much a sudden onset. It also lasts longer than your typical cold.
All right, so if people think they're getting the flu, what do they do?
If you think you're getting the flu, the first thing you do, you have a doctor, call and talk to your doctor. It is a virus. Antibiotics do not work. Tamiflu is effective. And, you have to drink a lot of fluids, can't stress as much fluids, water, Gatorade, Powerade. Also take Tylenol and Advil, Motrin for the fever, and get your rest. And typically the body fights off this virus and you're fine.
All right, so now, for those of you coming to see me this week, you don't want to come to see me if you've got the flu. And you don't want to go to your doctor unless your doctor tells you to, because you don't want to infect everybody else. So what are some of the other rules that people who have the flu should be doing?
Well, I can't stress enough about hand washing. You should need to wash your hands as much as possible. And, you need to, this time of year, really be a germaphobe, meaning, whenever you touch anything, you should think, it's transmitted by droplets. So if someone sneezes in their hand or coughs in their hand and then shakes your hand and you put that near your eyes and your mouth, that's how you get it. So just be really cautious and frequent hand washing.
Yeah, and that is such a good point. You know, this habit people have of shaking hands with other people. It's not so good if there's an infectious disease going around. You know, I remember a study from a few years ago, just like you were saying. You know, a virus can be transmitted. I think the same virus, like 30 successive handshakes, it can be cultured off of people's hands. It's really pretty disgusting if you think about it. I know I'm friends with Dr. Cliff Lacey, who used to be the Commissioner of Health in the state, and he would wouldn't shake hands. He would just sort of give you your elbow there, you know, instead of, which is a better way to do it, you know, or maybe a fist bump is better than.
I could, completely agree that maybe even like an air fist bump where you're not hitting fists for the next month or two until this is over, because that's how it's is spread by the hand touching and lack of washing hands afterwards. I think is one of the most important things to remember and try to prevent.
Yep. Okay. My guest this evening is Dr. Christopher Freer. He is the chairman of the emergency department at St. Barnabas Medical Center in Livingston, I believe, Livingston, New Jersey, which is now part of the Robert Wood Johnson Barnabas Health family. And there's a number of hospitals, and this is the first interview for St. Barnabas, and thanks so much for being on. And we're not done yet. I've got more questions for you. But St. Barnabas is one of the key hospitals in the network, with Robert Wood Johnson being the other key hospital, and many others, and we'll have representatives from all those different hospitals as we go through the weeks here on What's Your Wrinkle. All right, so we're talking this evening about influenza. Now, why is it worse in little children than adults?
Well, the very young age, the immune system hasn't built up quite as much, and it also children that have medical problems, born premature, their defense system is a little down compared to a child, a 6, 8, 10-year-old child.
Yeah, and I know that the more vaccines people get, the more years of vaccine, the better they seem to do, even if they do get the influenza. And now, I just want to ask you, how do you feel when you encounter someone that says, "Well, I'm not going to get the shot, I never get the flu"? What do you say to them?
Prevention's the best medicine, and if it's going to prevent even 30-40% odds of you not getting it, it's very important. And I mean, if we didn't as a nation get vaccines, it would be a lot worse than it currently is now. So we definitely stress prevention and the vaccine.
Yeah, and there's something called herd immunity also, not just the immunity that you get as an individual, but the immunity of your group. And if more individuals, more people in the people that you hang around with are vaccinated, there's less of a chance of anyone getting the disease. That's called herd immunity. I think I have that for a non-infectious disease guy. I think that's probably a reasonable explanation. What do you think?
I completely agree.
Okay. All right. So we're not going to shake hands anymore. That's number one. If you get the flu, you're going to call your doctor. And is it always necessary to be seen by your physician if you have the flu, or can your physician diagnose over the phone or with an iPhone, or what do you think? We're such high activity now, so if the symptoms, the CDC guidelines are, if it looks like the flu, you have the symptoms, we're in high activity, you have the flu. So they're not even recommending you get tested for it. They recommend treatment. So I think, as you're stating, calling your doctor is the first thing you can do. There's telemedicine. They can talk to you over the phone and direct you on what the next step should be for you. And just make sure you keep the fever down and keep yourself hydrated, and you'll feel a lot better. And the drug that you mentioned called Tamiflu can shorten. It doesn't get rid of it immediately, but I believe it shortens the symptoms and makes it so you're less likely to get seriously sick from the flu. Is that correct?
That's correct. What I tell patients is you're going to get better regardless with drinking, and just your body's going to win, but the Tamiflu does shorten the course. All
right. Well, it's the flu season. Be careful. If you have the flu, please don't go to the shopping mall. You don't have to be a hero and go out and get the food for your family that day. Don't sit there in the restaurant sneezing. You really have to have some courtesy for the rest of the world. It's bad enough that you're sick, but please consider everybody else. You don't want to make other people sick. You don't want to infect the little kid. Wouldn't it be a terrible thing if you went out, went to a store, you were feeling lousy, but you decided to go out, you infected someone, and they end up dying from the flu? So let's think about other people. It's very, very important. Dr. Freer, thank you so much for being my guest on What's Your Wrinkle this evening. It's been a real pleasure speaking with you.
You too. Thank you very much.
All right. Thanks so much. I'm Dr. Arthur Perry, and Dr. Christopher Freer is the chairman of the emergency department at St. Barnabas Medical Center in Livingston, New Jersey, part of the Robert Wood Johnson St. Barnabas family, one of the biggest chains of hospitals in New Jersey, and in my humble opinion, the one I would go to. But, I'm biased. I'm a physician at Robert Wood Johnson in New Brunswick, and it's so great that the hospital system has been significantly strengthened by bringing these two wonderful institutions together.